so that you can all learn something, hopefully, from this talk. I'm also going to try to keep it just to 15 minutes so that there's room for questions at the end. So the Eye Care Assistant program, or our Ophthalmic Medical Assistant program, is a one-year technical diploma. And it's going through some transitions this year that are really exciting. So I'm going to kind of wait to get to that point. Currently, we share the program with NWTC in Green Bay and also share the program with Gateway out of Racine. So I just included a picture of some students on our last day of clinical checkout. So this is who we are present day. I just took the picture and added it Monday. So I think some of the employers, of course, are going to understand who we are, but I just wanted to just provide some distinction about who is who in the eye care field, because our graduates can find themselves working with ophthalmology, working with optometry, or working in an optical setting. So just as a kind of a broad overview, an ophthalmologist is really essentially an eye surgeon. So an eye surgeon does an undergrad degree, goes on to medical school, and then another 4 years to specialize specifically in surgery and care of the eye. So I kind of like the face-to-face presentation because I can kind of gauge my audience by how they feel about these pictures. These are just examples of really very common surgeries that an ophthalmologist will do day to day. So as a graduate from our technical diploma, you could find yourself supporting an ophthalmologist so that you can make the ophthalmologist more efficient at caring for patients who may need a cataract surgery because vision is worsening. My lights went out. Vision is worsening secondary to the internal lens yellowing. So an ophthalmologist could be a doctor that you're supporting as a graduate. An optometrist would be another option. An optometrist is an eye doctor, and I am an optometrist. So I went to school for 8 years. I went to UW La Crosse for my bachelor's of science, majored in biology and chemistry, and then went to school in Memphis, Tennessee to learn about how to treat and diagnose disorders of the eye. So here is just an example you can see in the picture here of an angry eye. And this angry eye is a corneal ulcer. And that corneal ulcer is unfortunately something we see quite common also because if a patient sleeps in their contact lens, that avascular structure doesn't receive the oxygen it needs, and this is the reaction. The cornea is like the windshield to our eye or the windshield to your car. If it's injured, it can scar, and you can just imagine if you have injury to your windshield, you'll have a harder time seeing while you drive, just like if you injure your cornea, you'll have a harder time seeing out potentially. So what we depend on, a major role that our eye care assistants would do is educating patients. Hey, you can't sleep in this particular contact lens because this is the potential consequence. In order to resolve this injury, you'll need to use the drop the doctor prescribed 2 to 3 times a day, and can just really help with our communication piece. We spend a lot of time as optometrists behind this microscope here, just looking at the external and internal structures of the eye. Our students and graduates will do the same. And also, you can see that this eye is yellow, not from infection, but by putting a diagnostic stain in the eye. So that would be another role of an eye care assistant. And then finally, I have a picture here of an optician, or a couple of pictures of the opticians. And these are the people who fit our patients in their glasses. So the ophthalmologist, the optometrist, the eye care team writes an eyeglass prescription, and then it's the responsibility of an optician to make sure that the lenses fit correctly and the frame fits correctly. They're in good alignment so that the patient can receive the optimal vision that the prescription provides. So in summary, As a graduate from this one-year technical diploma, we really, as our mission, want to improve the quality of eye care in our communities by supporting eye doctors, eye surgeons, or opticians dispensing glasses. So as far as the program and certification, I think this is another exciting attribute of the Ophthalmic Medical Assistant program. Because we have so many opportunities to support different eye care members, we reserve that certification piece for graduation from the program. So once you've graduated from the program, you will find work with an ophthalmologist, optometrist, or optician, depending on what suits your personality and your interest. And then from there, after gaining employment, the academics that we've provided you should support you so that you can sit and pass any one of the competencies or any one of the certifications. From there, there's opportunity to ladder yourself upward within the field, which is always a really good attribute of any field. I wanted to spend just a moment talking about our outcomes. So just some examples of things that you would do as an eye care assistant once you've gained employment. Things that we'll practice so that you'll be successful with employment are doing, again, this giant microscope exam, looking at the surface of the eye for disease states, but also looking to make sure that the eye is safe to dilate, making sure that a contact lens sits as it should on the eye. And then here is a picture that's maybe hard to gain context, but I wanted to make sure to illuminate the idea that we work a lot at making sure that the vision is coordinated with a good moving set of eyes. So sometimes people have potential for 20/20 vision, perfect vision, but their eyes don't coordinate well. And so we'll spend time doing some of these very desirable competencies by learning movements of the eyes and maybe potentially prism that we could help patients with in their glasses. So these are two skills that really set students apart from other assistants in the field. Another thing that we'll do is we'll help patients with glasses or contact lenses. So we do an objective prescription check, meaning that we use a light to look at how the light bounces in the eye to determine how much power a patient needs. So this is really, again, a very desirable skill to be competent in because we don't have to really depend on how our patients answer us. We can kind of get a snapshot of their vision without their communication. From there, we'll go on to ask which is better, one or two. So you'll learn that dance that really helps patients see better. So there's in the healthcare field, there's very few examples of actually seeing your work be appreciated directly. So you really have the opportunity to write this eyeglass prescription and watch how your patient's life and quality of life improves with better seeing eyes. We spend a lot of time doing what's called lensometry, meaning investigating what a patient's current prescription is. So we can look at a pair of glasses and know what your visual needs are based on your current glasses. Another thing that we really value and another program outcome would be to work with an eye care team to schedule an appointment, to maintain records, and to bill insurance. So some people really like to be that forward-facing individual that greets patients when they come in and works with insurance. We've had a lot of graduates that have kind of gone into this discipline. But if you work in a private, smaller doctor setting, many times as an eye care assistant, you'll be asked to be a jack of all trades, meaning you'll be up at the front greeting patients, taking them back, looking at their eyes, writing an eyeglass prescription, and then following up at the end to give a patient a new pair of glasses. The thing that we concentrate on with this program outcome is understanding when to work patients into the schedule, how to work patients into the schedule. So knowing what emergencies warrant a same day or same minute appointment. So this takes a lot of time to kind of learn that skill set. And then finally, we really value our assistants working with doctors and patients. So we do a lot of drop installation, again, a lot of communication about the treatment plan. So as an eye care assistant, you would spend a lot of time talking to people all day long. So I like to kind of highlight that quality in that the best person to be a part of this field would be someone that really enjoys talking to people all day long and meeting an assortment of different people from all different age groups. So those are our four major, our major program outcomes. Now I'm going to kind of transition into what's new and exciting about the program. We are LTC's second CBE program, so we're competency-based education. And so what that really means is that we have all 32 credits offered at any time during the year. You have the opportunity to enroll each month, and financial aid is still available. But you would work with a program counselor to make sure that you're enrolling in the right number of competencies to ensure that you're eligible for that financial aid. We'll start again this summer, the beginning of June, and really almost every month after that. This is the best prescription for course order, but we understand that there'll be people that are already in the field that are maybe short on one competency or another. So there's that opportunity to really revamp maybe a skill that you've lost over time or one that you haven't learned. So I have a course details sheet that I'll share with anyone interested, especially prospective students, and I think employers would be interested in this as well. So I just took a little snapshot of this spreadsheet here. These are just the summer courses that we would recommend. There's some context as to what's actually happening in this course and how many hours we would expect you to be on campus or to be in a lab practicing a skill. So each of the competencies has a different value for face-to-face learning. Every class has a virtual, or excuse me, an online component. So there are recordings of skills and there are virtual assessments. So we have discussions, we have tests, all of which can be done remotely, but to actually practice and become proficient at the eye skills, we would expect you to practice in an eye lane. LTC is the best example of that. Gateway also has a lab as well. In this little excerpt, I have the textbooks that are included. I think a value of that is that we have a lot of open education resources, meaning no textbook is required. And so for the eye specific courses, there are only a couple of different textbooks that are required. Starting this summer, we'll have what are called open labs. And so these are the hours that I'm going to be here in my room that keeps saving energy by turning off the lights. And so what I would ask you to do is to sign up so that I can make sure that I am available for you, whether it's here or at Gateway's campus or virtually, should you have questions about any of your online competencies. And then there's the sign up here that you'll do for each month. And I will share this, it'll be a live document. I just wanted to also focus on our service learning opportunity. We work with Lions Club glasses, the buckets that you see maybe at a Walmart or a Walgreens, and we really work to refurbish these glasses and then send them back to the Lions Club so that we can send these glasses repaired and neutralized with a written prescription to help people that are in need. This year we put our brakes on school screenings, but we're hoping to get back next year to go out into the schools and measure vision. We do it both objectively, asking questions, and we have an instrument, or subjectively where we ask questions and an instrument so that we can kind of get a snapshot of a child's prescription. because if we can catch a prescription before age 7, we have the greatest opportunity to impact this patient's future vision. Another question we get is, of course, what is the wage? What can I expect as a graduate from the program? When I last surveyed students, graduates, the average hourly wage was $18.34, and that's approximately $35,000 to $40,000 for a one-year technical diploma. And again, the longer you're in the field, the greater the potential for your wage as well. The job look is exceptional, and I think that's part of the reason that we're rolling this into CBE. We are hopeful that we're able to get more people through the program and send people out into the workforce as soon as they are ready. We do have a Facebook group, and so I'm constantly alerting students and graduates of new job opportunities. I share skills that we're working on so that there is this community of eye care graduates that are really privy to what's happening in the field at any current day. And then finally, I just wanted to, again, highlight the idea, the cost, or the reduced cost for this one-year technical diploma, just 2 textbooks that are for the ophthalmic specific classes. We do have tuition reimbursement opportunities. So gratefully, we have both Baycare and Tower that will award $3,000 to reimburse tuition, which is pretty close to what the one-year cost is for this technical diploma. Don't know the exact cost. It's more than $3,000, but not a lot more. The cost per degree is here. So if you are an employer and decide that your staff should add on a particular skill, that's just a number to be mindful of. And so I went just a few minutes past my 15-minute goal. I wanted to make sure that I had time to answer any questions because, again, there are so many different people out in the first Lunch and Learn here at LTC. Any questions, any comments? Again, I know there are a couple of employers in this meeting. If you have anything to add, you're welcome to do that. And also our admissions advisors are welcome to contribute anything that you think might be pertinent as well.
This is Jim. I would like to hear, I do see Tony from Baycare, and I hate to put you on the spot, Tony, but if you have anything to add from an employer perspective, I think it's very, that's very beneficial information, I think.
Can you hear me now?
Yes.
Okay, sorry. I was actually just going to click in when right before you said that, Jim. So for any prospective students out there, I am one of the trainers here at Baycare Clinic Eye Specialist up in Green Bay. We are a large practice of over 15 eye care specialists. We are overly excited about the program. We will be working directly with them to get the students on board. Students from the program, ever since day one when Dr. Corey started, are incredibly employable to us. If we train somebody who has some basic medical experience, perhaps they've worked in primary care in the past, it will probably take me 2 to 3 months to get them operational on the floor to where we can use them. Students coming from Dr. Corey's program, typically I will have them independent, working independent. They understand our procedures within about 2 weeks. It's that dramatic of a change. One of our students from this past year has she spoke at a different meeting, but she has repeatedly expressed to us that being able to work in the field simultaneously with going to school gave her that the background knowledge, the how, the why behind the how, and then here she was seeing it firsthand. I'm one of those people that I also like to learn hands-on right in front of me, and if I have read it in a book, there are many times that I have to read it several times in order to make it make sense to me. But when I see something first, And then I go back to the book again. There's that aha moment, and everything seems to come a lot easier. You also are better prepared for patient safety. Here, you know, when you're a student, we want to watch you, make sure you're doing everything that's not going to hurt our patients. But at the same time, you're learning. You need a chance to practice those skills. When you have a program like this, it sets you up to be able to come in with me and work closely here with patients that I'm right at your side, also guiding you through it, but you've already had the do's and don'ts through Dr. Corey.
Excellent. I'm really glad that you brought that up. That's a great comment, that there is the opportunity for students to gain employment while going through the program. And I definitely encourage it because they're valuable, of course, to the employer, but they're valuable to all of the learners in the individual cohort because they have just so much to contribute about the field. So thank you. Anything else, Brittany? Was there anything in the chat that I should acknowledge? No?
No, nope, there's no questions or comments.
Wonderful. I see you, Dave, as well. Anything that you would like to add or?
No, I first of all, thank you again, Corey, for presenting this and for all of you that were able to attend. It's greatly appreciated. This is our first Lunch and Learn, so it's exciting to kick this off in this format. I guess the thing that I would like to say is if there's any prospective students or guests on the call, an admissions advisor will follow up with you afterwards to try to help you if you have any specific questions that maybe you don't feel comfortable asking in this larger setting. An admissions advisor will reach out to you and make sure that we help answer any questions you might have, especially anything that maybe you've learned or hopefully you're excited about moving forward. So a follow-up conversation will likely happen. So just wanted to let you guys know that for those that were on the call.
And I would just add to that too, Dave, if you're a prospective student, there are a lot of job shadow opportunities. So the admission advisor can kind of help connect you with me, and I can connect you with employers that are really very welcoming at allowing you to see firsthand what this field actually feels like, because I think that's the best way to know if this is something you'll be excited about. And we all are here. So thank you so much for all of your time. I appreciate it.
Thank you, everybody.
Have a good rest of the day.
You too.